Can you explain the processes that may be part of the procedure that are involved and pointed towards the preservation of sexual function?
With respect to male sexual function, there's an evolution of knowledge happening at the moment. So in the past, we used to think that the bladder neck was absolutely critical for ejaculation, and that any procedure we did which was done up at the bladder neck would render people an ejaculatory or a condition called retrograde ejaculation. What we'd always believed was that the semen would be going back into the bladder if we did surgery up at this level. This is an area of an evolution of knowledge. We knew all along that it wasn't a foregone conclusion that if you did a procedure at the bladder neck, that patients would have a problem with ejaculation. But there is an increasing thought that in fact it may be when surgery is done down near the ejaculatory ducts and they come into the urethra just below the prostate, interestingly at the level of another part of the sphincter mechanism. So you've got this area, if you like, is an internal sphincter mechanism, and then we have the pelvic floor level of muscle, which is a different type of muscle to the bladder. At any rate, down here is a marker for where these sphincters meet. If there's damage to that area, one of the consequences can be incontinence, and people are starting to believe that this may be where the focus for ejaculatory dysfunction occurs. A lot of the patients who are undergoing prostate surgery are not troubled as long as they're aware of this consequence, and it is much more appropriate if you're having prostatic or bladder neck surgery that may be a consequence, because at this point in time there's no way you can guarantee that ejaculatory function would be preserved with prostatic surgery. Of course, ejaculation is not the only sexual function, so the nerves that subserve erectile function run along the prostate on the outside, and surgery that involves prolonged surgery so a much bigger prostate is at more risk of being associated with erectile difficulty. A complete removal of the prostate is much more associated with erectile difficulty. Having said that, in general terms, when the prostate's operated on to relieve obstruction, is a very low risk to erectile difficulty. And in fact, taking away one of the health problems that's bothering somebody can be associated with an improvement in confidence and therefore sexual function. So, it's not an absolutely straightforward situation, but generally speaking, prostatic surgery to relieve obstruction does not cause erectile difficulty.